practice of therapy is or can be incredibly isolating.
I can't imagine practicing therapy in solitude.
While I'm in the room with a patient, there's also, 8 more people in the room with me.
Being part of a community of therapists that I really admire, I think I've learned a lot just from how other people practice.
I don't know, I look at it like playing with other musicians. You learn how to play, or we actually learn how to play together. We learn how to work together.
I think we really root for each other.
We've got corporate professionals, lawyers, Wall Street folks, but tons of creative folks, folks who work in advertising, visual artists, musicians, actors.
They're not gonna settle for therapy that's not really working for them, and it makes the patient population challenging, but I think in a way that keeps us very accountable.
We don't follow a particular methodology. So for example, we're not a cognitive behavioral therapy shop. We're not a CBT shop, we're not a DBT shop, we're not necessarily psychoanalytic. Our work is informed by all of those things. We've managed to create a practice where the methodology is really about being creative as opposed to applying a particular approach off the shelf.
I'm not just thinking in the CBT mentality, I'm thinking in the family systems mentality, or I'm thinking in as an art therapist might think.
When we use the phrase non-diagnostic, which is part of how we advertise our work to prospective patients or clients, what we're trying to get at is that our approach is counter to the medical model.
I felt like the practice really put their politics forward, and I think it's not useful, especially in how our culture is changing, to really just be a traditional blank slate therapist and not, let your patients know what you think. I have an understanding not just of their specific circumstances, but their specific circumstances in the context of, cultural and political forces that we're all affected by.
We talk a lot about our therapy at Tribeca as being creative, and what we mean by that is less creative in the sense of artsy, though certainly the arts are a meaningful part of our work, but more really valuing therapy as a creative activity, particularly when you're doing work with bright patients, that each individual course of treatment really needs to be created by the people doing it as they go.
They've taken a lot of effort to get to know me well and encourage me in the ways that I need.
A lot of therapists have supervisory trauma. She knows me very well and knows my practice very well and knows me as a person.
It's definitely the best supervision I've had anywhere I've worked or in school.
Some of the offerings that we're adding have really been inspired by the interests of folks who work with us. So for example, we're in the process of doing a lot more work related to fertility, maternity issues, and postpartum depression in particular. We have been doing more and more couples therapy in the practice, and that's becoming just a huge part of the work that we're doing. Started a business which we're in the process of launching in the next couple of months called Emerging Practices, which is intended to exist as a place for folks to come and train in the kinds of modalities that tend to not get a lot of attention and around the kinds of issues that tend to not get a lot of attention. So all of the therapists here have been and will be a part of that as that grows. I wanted to build a practice where I wanted to go to work every day.
The biggest way that I've grown is my comfort in taking risks with my patients.
I think it's made me push my patients and made me take better and bigger risks.
We can be serious and learn a lot, but also play silly games all the time.
And then there's a lot of mutual affection and playfulness and respect that just makes this atmosphere really safe and comfortable and fun.